I come from a family where, as an immigrant, my mother had low-paying jobs. She had absolutely no job security when we first got here. We lived in a one-room boarding house where the three of us slept sideways on one bed. I know what it's like not to have health insurance or health coverage. And my greatest fear as a child growing up in this situation was that my mother would get sick. She had no health care coverage. And if she got sick, she couldn't work. And if she didn't work, she wouldn't get paid. We literally, even when she was working, I tell you all this because I think it's really important for those of us who sit here making these decisions to understand what it's like for American people not to have this basic kind of coverage. So my greatest fear was my mom would get sick, couldn't work. We literally wouldn't be able to pay rent. I mean, even when she was working, we would run out of money by the end of the month. So I know what it's like. Also, I grew up in a very rural part of Japan where we didn't have, I would say, adequate access. Access, very important, affordable and access to health care coverage. And my baby sister died of pneumonia in Japan as a result of lack of, in my view, lack of health care. So I know what it's like. And for us to sit here and have to address this issue of millions of people who are going to get kicked off the ACA because we are not going to continue the tax credits. You know, when you talk to the Republicans, it's like you want to say to them, what world do you live in? That we can give continue the tax credits to the billionaires who are not even asking for it. That has to continue. But when it comes to the tax credits for the ACA to make healthcare affordable for millions of people in our country, it's like, oh, well, it can't be done. It just makes my head explode.